Welcome to The Explainer. Today, we're going to break down how a doctor solves a medical puzzle, and it all starts with a single common sound. So let's just imagine this for a second. A kid starts coughing. You know, if you're a parent, that sound can be instantly worrying. But for a doctor, well, that's the first clue in a really complex puzzle. Is it just a cold, or could it be something a lot more serious? So to really get our heads around this puzzle, we're going to deconstruct the whole diagnostic process. And you know what? We're going to do it by looking at just one thing, a single web page. It's a page designed to teach future pediatricians exactly how to do a respiratory exam. Okay, so here's our guide for this whole thing. It's a page called Respiratory Exam from a website called Teach Me Pediatrics. It's written by Adam Bonfield, and it was last updated back in 2018. For the next few minutes, this one page, it's our entire universe. Right off the bat, the page welcomes its readers like this. It's super clear, super direct. It tells us exactly who this is for, students, trainees, and what it's for, practicing for exams, and, this is the important part, actually managing real patients. But it's more than just a welcome message. The page makes this really fundamental promise. It's not just a big list of facts. Nope, it's a whole framework, and it's built on two really big ideas. And here they are. The entire thing boils down to these two pillars. On one side, you've got what to consider, all the key signs, the symptoms, everything you're looking for. And on the other side, how to structure it, the step-by-step systematic way you actually do the exam. So it's basically the what versus the how, the content versus the process. Okay, but wait a second. This brings up a really important question, right? You could be the smartest person in the world, have all the medical knowledge memorized. So why does the order you do things in matter so much? Well, it turns out that structure, it's everything. It's what makes sure you don't miss a single thing. It's like a reliable bridge that takes a doctor from a really simple symptom, like that cough we started with, all the way to an accurate diagnosis. And believe me, the stakes here are incredibly high. This is not just some academic exercise. A good structured respiratory exam, it's the frontline tool for catching really serious conditions. We're talking everything from the barking cough of croup to the lifelong challenges of cystic fibrosis. I mean, just look at this list. This is exactly why having a reliable method is absolutely non-negotiable. Okay, so we've established the respiratory exam is a vital, even life-saving tool. But and this is important to remember, it's just one tool in a much, much bigger toolkit. If we take a step back and look at the whole website, our source, we can see that the respiratory exam sits right alongside other core skills, like the cardiovascular exam or the abdominal exam. Each one of these is its own structured process for a different part of the body. And a doctor, they've got to master all of them. All right, but let's zoom out even further. One more time, this entire toolkit of hands-on examination skills, it's still just one tiny little corner of the huge, complex, and honestly kind of overwhelming field of pediatrics. To really put this in perspective, we went through the Teach Me Pediatrics website and grouped all the main topics. And look at this chart. All those exams we just talked about, they make up that tiny 5% slice. Now compare that to these huge areas like emergency medicine, cardiology, neurology, each one of them taking up 15%. That is a staggering amount of information to master. And that right there brings us to the real lesson here, the true takeaway from digging into this one single web page. The lesson isn't just about how to check a kid's breathing. No, it's about something much bigger. It's about the power of structure to help us navigate overwhelming complexity. I mean, think about it. Whether you're a doctor, an engineer, an artist, you're gonna face unbelievably complex problems. What this webpage really teaches us is that the key isn't to memorize every single fact under the sun. It's about mastering a structure, a reliable method that lets you cut through the noise and find clarity. So that's the thought I want to leave you with. In any complex field, where does true expertise really come from? Is it about knowing a million different facts? Or is it about knowing the structure that connects them all and gives them meaning?